There is a kind of church that the devil is happy with. In fact, some people all their life don't know what church looks like. They've just
From your experience,
Yeah.
Doctor, what are some of the most common cause of infertility?
The commonest cause of infertility in our environment is tubal problem. When we look at women, when we're talking of cause of infertility, we have to look at the woman's side,
Both
we have to
sides,
look at the male
yeah.
side. Both men and women share equal weight of problem.
True.
Before now, it's believed that it's the women that have the problem, and men don't even bother to come for tests,
checkup. Yeah.
because if you are not conceiving, you are the woman, you are the one. But it takes two to tango. Without the sperm, the egg cannot just form a baby.
fertilize.
Dr. Sunday Onu, the fertility specialist and founder of Detta Hospital, who trained in Copenhagen.
I've heard some people throw fallacies like doctors have said that if they don't sleep with a girl, the sperm will keep accumulating, it's causing stomach pain. So
Those ones,
you read some of those.
Of course, no, I've had. I've even had telling a girl that if she doesn't sleep with men, that she will have a disease.
Yeah.
Because people try to bring fallacy to woo,
To all those things.
in order to mislead young girls and young
Does
men.
masturbation cause low sperm count or azoospermia?
No.
Mastered the science of human reproduction and came home to Abuja to give thousands of Nigerian families
Sperm count have been on the decline over the years.
Over the years.
Over the years, when you look at the past 100 years, for instance, over the decades, over the years, it's reducing. Yes, and it's all because of these environmental toxins, preservatives, things we eat, we don't eat well, we don't eat. Yeah, it's accounting for it. Even the WHO have been lowering standards of what is normal sperm count.
Something they had almost stopped believing was possible, a chance at parenthood.
When we did this study, even though it's quite some time now, about getting up to 10, 15 years, we discovered that apparently there was no difference in terms of sex ratio. At birth, we tend to have more males than females at birth. At birth. But when you go higher, at adulthood, there are more females than males because females are more resilient. They survive childhood better than males.
Some people believe that if you're going for IVF and you have to choose the gender that you want, that means you are playing God.
No, I would say no. Because if IVF were an automatic pregnancy, then that becomes IVF, no matter how excellent the center is, anywhere in the world, IVF does not guarantee pregnancy. So where is the God playing there? You can choose the embryo gender that you want to put, but you cannot guarantee that there will be pregnancy.
Now, considering now the wider range of options for people who are dealing with fertility issues that they can explore, are there things that can increase the chances of IVF working and things that can reduce the chance of IVF not working?
Oh, yes, there are.
Hey friends, I want to welcome you to the Classified Podcast. Myself and my team, we've been working so hard behind the scene to get different intellectual conversations across to you. We know that these conversations will form the basis for what will change our world as we know it, because words form narratives shape culture. And this is the reason why I want to invite you to join me on this journey, not just as one who is going to view this today. I want to have you on board with me. And I like for you to just do these 3 quick things for me. Number 1, I like for you to like this particular podcast. Don't just watch, just like. I want you to do that for me. And when you do this, the algorithm takes this to as many people as possible who can now have access to enjoy the very same thing you're enjoying. Also, I'd like for you to drop comment. Let's know how this has impacted you, things you've learned, and sometimes just your own view. And I'd like for you to also subscribe on this YouTube channel. I'd like for us to grow together as a community. I look forward to having you again and again on the Classified Podcast, and I can't wait to see you some other time. Thank you.
All right, I want to really thank you. This is the first time we are starting this conversation with a thank you. For some reasons, we just like to shoot and just go straight to the conversations. Yeah. And I know what it takes for you to make out this time to be seated here. I think you are by far the most busy doctor in Abuja.
I wouldn't say so, but I mean, I know I'm busy.
No, I think by far. I mean, everywhere we have conversations relating to fertility with women in respect to that, counseling and all that. One name stands out all the time, Dr. Ono. Dr. Ono. Now, I just want to get straight to it. With some of the things that you do now in this field, the knowledge available even here in Nigeria, do you believe that women still have reasons not to have kids?
Yeah, apparently, I mean, that's a deep question, and it's deep rooted. I mean, if we look at it scientifically, but on the surface, just to summarize, there are a wide range of options now.
Wider range
compared to what existed before. That you say, look, I mean, it's apparently difficult to say a family can go without children because options exist. However, some of these options have some limitations, so to say, limitations of acceptance because of the depth of knowledge people have about, what is offered and people's belief, and set mind. These are just the things that are constraining some couple in achieving.
Dr. Ono, do you want to run us through some of the options that we have on ground now for women and let's say family generally that are going through fertility issues that they can choose from, and some of the limitations or the pros and cons of some of these options?
Okay, yeah. The options are varied, they are wide. And if you look at it, sometimes what the couple need to actually achieve conception is small, but they are looking for the big answer. I mean, looking for a bigger solution. Something happened yesterday. I was pleased and amazed. A woman came to me, routine, normal clinic, fertility check, and the rest of them. And she said, apparently she wants to do IVF, but however, I should just use my medical judgment to give her the best option, because a friend of hers came to me, and was coming with the mind of IVF, and I told her, I've forgotten, I can't remember what this is. I told her that no, she should just wait a little bit, that her case might not just be an IVF. And I gave her some medication, and she has a baby now. I was surprised, Wow. I was surprised. Some people, to some people, it might just be simple advice. Do it this way, do it this way. Then some people, they will need medication. It's just to give some tablets and monitor their cycle to know exactly when they ovulate, so that, they can meet with their husband at the appropriate time. Yeah. That's what we call ovulation induction and timing of intercourse, time intercourse. Then there is other option of just giving some medications that have suppressed the person from ovulating, and ovulation comes and pregnancy enters. Then in terms of interventions that are invasive, I mean, when we say invasive, I mean when you have to handle gametes. Yeah. There's the one we call the intrauterine insemination. That is a little bit going a little bit higher, where you have to just take the sperm from the man, try to prepare it very well, because you can't inseminate a raw sperm into the woman's uterus, because sperm, even in the natural pattern, the raw seminal fluid don't go into the uterus. It stays in the vagina. It's the sperm that swims up. And there's one thing that, I usually don't withhold clarifying, because some women believe that what the man ejaculates is what goes in everything. No. The sperm cell inside the ejaculate is something naked eye cannot see. And it's in millions, you can't see them. And it's a very small percentage of the whole volume of fluid that is ejaculated. And that is the active ingredient that we need for fertility, so to say. So we want to, prepare the entire seminal fluid to sieve the other components so that we can concentrate sperm alone and, make the active one, available that you now inject directly into the womb by way of insemination and allowing them to go on and do the duty as it would have been ordinarily.
From your experience, Doctor, what are some of the most common causes of infertility?
Yeah, the commonest cause of infertility in our environment is tubal problem. When we look at women, when we're talking of cause of infertility, we have to look at the woman's side, we have to look at the male side. So, and before I say further, I want to say that both men and women share equal weight of problem.
True.
Before now, it's believed that it's the women that have the problem, and men don't even bother to come for tests, because if you are not conceiving, you are the woman, you are the one. But, it takes two to tango. Without the sperm, the egg cannot just form a baby. So when we look at the women's side, the tubal problem is the leading cause in our environment. That's tubal blockage, tubal disease from one thing or the other. And why is it very common? Because infection is very common in our environment. Sexually transmitted infection, other form of pelvic infection. Because we have a problem that leads to surgery. Fibroid is very common in our environment.
I'm still going to get to the area of fibroid.
And fibroid, the number one solution to fibroid in our environment generally is surgery. And, when you do surgery, no matter the degree of precision and accuracy, there is bound to be scar tissue formation.
True.
Anybody that has a one-form scar.
Yeah.
So, but different people have different tendency of the extent of scar they form. Some form excessive scar, some don't form at all. Then the manner in which the surgery is done also influence the degree of scar formation. So when you do fibroid surgery, one of the complications is that, scar might form and that will involve the tubes and will lead to tubal blockage. But if the surgery is done by a specialist, that's what we advise. If you must do a fibroid surgery, make sure it's done by a specialist who have the knowledge that, it's not just to take out the fibroid, but it's to take out the fibroid and leave the woman fertile.
Leave her fertile.
Yes. So care is taken in way and manner you handle or manipulate the uterus, And other surgeries, some people have appendix that will rupture, can affect the tubes because it's an infection, it's an infective disease. Yes, it's infective. And when infection comes, there's inflammation, there's tissue reaction. At the end of it is scar formation. And this could affect, the tube, the lumen of the tube is very narrow. So any small thing can just block it. So that's why it's leading cause in our environment. The other cause will be ovulation problem. Some women don't ovulate or they don't ovulate effectively. And that could, without ovulation, egg is not released. And if egg is not released, even if sperm is there in millions, nothing to fertilize. So these are issues. Then we look at other problems like, masses, like fibroid.
Yes.
Fibroid and fertility, they have causal and causal relationship. Causal means, the infertile population tend to see fibroid more in those population. And there are some people that, it is the fibroid that is actually the cause of their fertility delay or fertility challenge, depending on the size and the location of the fibroid. Very key. You can have a big fibroid that will not even interfere with fertility if it is located on the outer wall of the womb. You have a small fibroid like this that if it's sitting right inside the cavity of the womb, that will prevent the woman from conceiving. No matter, how small it is. So location and size is very key when we're talking about fibroid. And some could just be close to the tubes, and because of the effect of the mass, it blocks the tubes. and we'll have fertility challenge there.
Now, Dr. No, before we still get to, looking into the wider range of options for fertility for women, we're talking about the cost now. This issue that you're on is a very serious issue now. The issue of fibroid, the issue of PCOS also. It's like there are many more issues that, I don't know, maybe kind of is reducing the probability for conception. Women have to deal with hormonal issues, and they are becoming more prevalent. Fibroid is almost everywhere. It's like you're looking at 1 out of every 3, and then you're looking at also PCOS. What are the causes of some of these things, and what can be done? Maybe a single person is watching right now, or even a married person. Are there lifestyles, things that can be done to avoid some of these things?
Yeah, I would say, unfortunately, these 2 things you mentioned are major factors in fertility.
Yes, they are.
Particularly in our environment. And if you take a PCOS, that's polycystic ovarian syndrome, world over, if you look at the number 1 cause of infertility, if you take the world, the developed countries, ovulatory problem, and PCOS is the major cause of ovulatory problem. That's an ovulation. Can see that it's a major factor. The PCOS is actually a condition that people are born with. It's not like you acquire it along the line or something like that. It's a nature of the ovary, that appears polycystic in nature. Then when we talk, some people have polycystic ovary without having the polycystic ovarian syndrome, because the syndrome is like when other things have now come up, are now involved. The polycystic ovary can is the foundation, to having PCOS.
Yes.
Of course, and we know that some people can even have PCOS without having polycystic ovary. It's a very minor percentage of people. We'll call it the other variants of PCOS. Now, I say that 1 out of every 3 women, in reproductive age, have polycystic ovary. It's common. But, it's not all that are syndromic. It's not all that are polycystic ovarian syndrome. And it's not all people that have the syndrome that actually have fertility challenge. Some can escape it, and some will just have the challenge, because polycystic ovarian syndrome come with different symptoms. Some is excessive hair. You see a woman growing hair like man.
Green beards.
And then acne. So much of breakouts on the face everywhere. Because of hormonal change, they have excess of the male hormone in them. And this change in hormone actually affects ovulation. And that's also have other health implications like diabetes, mellitus in later life, cancer of the endometrium, cancer of the womb because of prolonged absence of menses and the rest. Now, when we talk of PCOS and lifestyle changes, there's a relationship. When you have polycystic ovary, even before the syndrome, there are things you can do in terms of lifestyle adjustment that will prevent the syndrome, as it were, because the polycystic ovarian syndrome is a hormonal derangement, kind of, that will now lead to the cascade of events that will happen. So if one is careful, diet, trying to avoid carbohydrate diets, that's too much of sugar. Yeah, because polycystic ovarian syndrome, the larger variety of it have what we call the insulin resistance pattern, and that is a major factor. If there's insulin resistance, insulin is the hormone that is responsible for driving sugar into the cell from the bloodstream. So if there's resistance to it, it means you have accumulation of sugar within the bloodstream, and accumulation of sugar causes a lot of damage to tissues, to organs, and that is what eventually will lead to diabetes, so to say. So if you're mindful of your diet, take down carbohydrate, increase your veggies, and increase your protein, watching the carbohydrate side, then you can, balance this to a large extent. Then exercise. to avoid excessive weight, because with weight, there's more of the female hormone, and the female hormone, which is the estrogen, can be turned into the male hormone by a process within the system. If it's much, it gets, we call it aromatization. It now have much of male hormone in a female. Then it now begin to make the system, to work towards the male side. And male shouldn't ovulate. if we want to say it that way, so these are the mechanism. Because one is born with it, there are things you do, to try to limit or to negate, the manifestation of this thing, or even where it exists, you can actually put this together to make it lighter. Like polycystic ovarian syndrome is also associated with weight gain, so to say. So if you are now conscious about the weight and you bring down weight, studies have shown that people who are obese with polycystic ovarian syndrome, when they lose weight, it reverses a lot of imbalance that there is, and a lot of people have conceived by doing weight loss just alone. If the anovulation is their major problem, that's a PCOS, if there are no other factors of fertility. Then going to fibroid. Fibroid is also as common. I mean, it's that common too, particularly in our environment. And it's something that we're born with. There's no such thing that you do at adulthood that will not make you have fibroid. I mean, as per, not that you are born with fibroid, the predisposition to have fibroid is in us. It's in the black gene, so to say. The white, the Caucasians don't really they don't deal with fibroid. They have their own problem. Everybody have their own thing. So to the extent that the blacks in the West, in the UK, in US, they have more fibroid than even the white there. So the thing is associated with the gene. Now that the gene is a predisposing factor, there are some things that have been said to try to potentiate or aggravate the development of fibroid. Even though there are theories, some theories have said that lack of vitamin D, vitamin D deficiency, and that in modern day life for us now, I'm also guilty. We move from dark to dark, dark to dark. I mean, from your house in the morning, you enter the car, no light, no sunlight. You enter the office, the time you are closing, the sun is down, you go back to the house, sometimes for 1 week, I might not even see the...
But there could be supplements that one could...
Yeah, exactly. That way supplementation comes in. We need to check, what's your vitamin D level. One thing is, vitamin D, even though supplemental, it shouldn't be taken blindly.
Yes.
Because excess of it is bad. So before you start taking vitamin D, you must check to know the level.
Yes.
And when you check randomly, you find out that a quite percentage of us have low level of vitamin D these days, and even abroad too, that's why they like coming to do sun tanning, this and that and that.
Just
and that. Yeah, so vitamin D supplementation is important. It's even good for fertility too. When there's low vitamin D, it affects implantation, it affects the quality of the egg, so all this vitamin. Not too much digression from the fibroid itself. And fibroid, as it were, we're talking about fibroid, is common, but not all fibroids are really troublesome. I would say not all, because they depend on the location, the size, and the symptom that is presenting with. And one of the major symptoms is excessive blood loss during menses. Particularly those that are inside the cavity of the womb, or the large ones that are in the muzzle wall. They increase the surface area that bleeding happens from within the lining of the womb. And, so when menses comes, you bleed so much. It comes heavy. Then if you are the type that you don't really eat right, and you are not supplementing iron, Then by the next menses, you bleed heavy, you don't recover another menses. After some time, you become anemic.
Yeah.
And some people have even gone to the point that needing blood transfusion and the rest
Just
of
because of that.
Just because of that. So, we need to be conscious of our
diet, lifestyle.
Yeah.
These are. Let's talk about males. Two very sensitive questions I want to ask. Look at some things that males deal with. You can also include some other ones. Low sperm count. And let's deal with that. What makes a man predisposed to that?
Okay, low sperm count. Talking about males, low sperm count is just the main factor. I mean, low sperm count or no sperm is the main fertility factor for male because it's the sperm. It is very, very easy to diagnose that a man has a problem. That is, bring your seminal fluid to analyze, and the result is just there.
Yeah.
But the question now is, finding a solution is more difficult. It's more difficult, yeah. Because most of this low sperm count, when you diagnose it, finding the cause becomes another, task, And most of the time, we don't get to even see any cause because it's a genetic predisposition. The thing just starts at a point and it starts going down. And that's why we also encourage that, okay, people should not, once in a marriage situation, once there's delay, don't keep waiting forever.
Yes.
Check early that we know where problem is. Don't push your wife alone to go checking. You two should just check, so that, it can be nipped early. So now there are some things that are known to be responsible for low sperm count. Number one, infection is there. Infection of the testes, infection of the passage. Just like we have tuber block in women, we also have the blockage of the tube of men. If it's blocked, you can be producing sperm normally, but it's not coming out, so it's of no use. It can't function. But technology have come that we can overcome such.
Does that put any weight on the seminal vesicle? Doesn't the tube no weight on it?
No. Seminal vesicle is there producing fluids and the rest of it. Even if seminal vesicle is blocked, it does. The vesicle produce fluid. It's the testes that produce the semen. The sperm. Sorry. And now is the seminal vesicle that produce most of the fluid that the sperm now come and flow in.
And now that is not, the tube is blocked.
If the tube that is leading from the testis down to the urethra, if it get blocked, nothing flows. So when sperm is produced, what happens is that after sometimes it dies off inside, and the body takes care of it. So it doesn't really accumulate to cause problem.
Some people, I've heard some people throw fallacies like, of course, I know medically, but doctors have said that if they don't sleep with a girl, the sperm will keep accumulating, it's causing stomach pain. So
those ones,
you've heard some of this.
Of course, no, I've had. I've even had telling a girl that if she doesn't sleep with men, that she will have a disease. Because people try to bring fallacy to woo,
to all those things,
to mislead young girls and young men.
Does masturbation cause low sperm count or azoospermia?
No. Emphatically no, in terms of that, because what happens with sperm production? Sperm production is a daily event. Yes, it's a daily event. It's not like the egg that have a cycle. A lot of the sperm that starts its journey from production site, the factory, which is the testis. Today, we get matured in 67, 74 days time. The one that start tomorrow will mature another. So every day you are seeing matured, the one so it's a continuous thing. So if there's a break in channels or if something affects this production line, that's why it's going to affect a lot of cells, production. So, and even if a man ejaculates every day, it does not stop the production. What happens is that the volume goes down.
Reduces.
The volume reduces because the volume is coming from the seminal vesicle largely. The volume reduces because you've not given time for accumulation before ejaculation. And that's why we advise in a marriage situation, a couple relationship, where there's for maximum fertility outcome, we say, okay, meet with your wife at least 3 times a week, but not like 3 days straight on, then 4 days gap. So you give gap in between. I mean, that allows reaccumulation of the volume, for...
the 3 days, is it a recommendation for every couple or for those who are looking for...
No, that's fertility recommendation. I mean, looking for pregnancy, fertility. I mean, if... a couple relationship is at their discretion, but where there is now a problem, then we'll now do a prescription. Yes. And the reason is not just out of the blues. There's a reason for that. The reason is, if you can know your ovulation time and everything, our prescription is meet at the ovulation time. But because, sometimes it's difficult to begin to do this, do that. What we know, science knows that if a woman ovulates today, the egg will not die today.
Yes.
It can stay 24, 48 hours.
Yes.
If a man ejaculates today into the woman's system, the sperm can live in the reproductive tract of the woman for 48 to 72 hours. Meaning that if you meet with your wife today and the wife ovulates tomorrow, the sperm can still be there waiting. Yeah. So that we don't lose any time. That's why I would say give this gap. If you meet with your wife today and apparently she's ovulating tomorrow, you have not lost anything. The sperm is still there.
You've scored the point, just waiting for.
Yeah.
You want to list some of the lifestyle change that men need to have to be very, very fertile?
Lifestyle modification for male is also, is very important because some of the things that are associated with low sperm count are some of these endocrine diseases, diabetes, for instance, hypertension on one other side too, and people, excessive, smoking, cigarette smoking, alcohol, excessive alcoholism. So all these are things that affect sperm function. Some people might not even have problem with the count, but the function. Sperm is, you have good count, but they are not moving. You have good count, they are dead. So diabetes can cause that. All these things are. So if you diet well, if you good exercise, and try to reduce mental stress, because mental stress affects performance, sexual performance. In terms of some men who say, they go home, they are tired, they can't meet with their wife, and that is the time that ovulation is taking place, and this cycle.
I just remember the case now. And let's discuss it hypothetically. He's a guy. Whenever he meets with the wife, the following day, he can't do anything. He's so tired, he's breathing, and he's saying, look at the stress. Just yesterday, you've caused all this. He's breathing hard. He will sleep throughout the entire day. What do you think can be wrong?
No, that is an abnormal situation. It's not normal. Because we know, you need a lot of energy. Ejaculation takes a lot of energy from a man. That's granted, but not that extent. So such person needs to get checked because there might be other issues. There might be other issues that are being brought forth with that. Yes, it needs to get checked. So that should not. You check out. Let's look at some men have 4, 6 wives. And they have businesses all around, and they're doing well, So,
True. True. Do you think that maybe some of the modern foods that we take now has also affected?
Yes. We can. We cannot exonerate a lot of things because of. preservatives that are in the food, not the food itself, but a lot of preservatives. These things are not just free of harm, just that we don't know the extent, because over the years, I'll tell us that the performance for men have been, in terms of, sperm count have been on the decline over the years.
Over the years. I mean, when you look at the past 100 years, for instance, over the decades, over the years, it's reducing. Yes, and it's all because of these environmental toxins, preservatives, things we eat, we don't eat well, we don't eat. Yeah, it's accounting for it. Because if you look, and critically because of that, even the WHO have been lowering standards of what is normal sperm count. Lowering standard, because when you now check, but the good thing is, even with the decline, as it were, it's also discovered that even as it's declining, it's still performing. So that's why the standard is lowered. In the past, they say, okay, sperm count, in recent past, the minimum count taken as normal was 20 million per mil. But now it's 15 million per mil, because it's discovered that people who have between 15 and 20 were performing the same thing. People have over 20, and now less number of people are now even having up to that 20 to meet up. Yeah. So the bar was dropped. As what is normal count, because even at 16, fertility was still optimal. Yeah. Recently we've seen, and I don't know if something you've noticed also as a fertility doctor, that there's been reduction in number of males that have been born.
No, apparently.
Do you think that's true statistically?
No, statistically, it's not really correct. So we can't. I did a study, on sex ratio. Try to check those born by IVF.
Yes.
Those born conceived naturally.
IVF is more predictable.
No.
You can choose. You can decide.
That is when you are now intentional.
Yes.
When you are intentional. But, a lot of people do IVF not being intentional. As per, I want a child. Anything God give me, I take. Is people come being intentional. Okay, I want a girl, I want a boy, because I have two boys, I have one. That's different. But when we did this study, even though it's quite some time now, about getting up to 10, 15 years, we discovered that apparently there was no difference in terms of sex ratio. At birth, we tend to have more males than females at birth. At bet. But when you go higher, at adulthood, there are more females than male. Because females are more resilient. They survive childhood better than males. Yeah. it sounds, it sounds somehow, so.
Till now.
Yeah. So unless things are now changing in this era, decades, but sex ratio has really been on the balance. There's a slight male preponderance, but now, with advent of IVF, with advent of gender selection and everything, so it's going to change the scenario in the world, because things are no longer, it's no longer left to nature.
Some people believe that if you're going for IVF, and you have to choose the gender that you want, that means you are playing God.
No, I would say no, because if IVF were an automatic pregnancy, then that becomes IVF. No matter how excellent the center is anywhere in the world, IVF does not guarantee pregnancy.
True.
So where is the God playing there? You can choose the embryo gender that you want to put, but you cannot guarantee that it will become that will be pregnant, that there will be pregnancy. And science will also tell you that even if when we are doing gender selection with the most precise technology, it will still give you error margin.
Certain error margin.
Margin of error. That look. we have selected this is a
It's
girl, but
likely
it's likely it might just come out to be a boy. And we have had a lot of cases, coming up that way. Just that if the people that are coming forth for this are well educated and well counseled, they know and they'll take whatever comes in good faith.
Another thing that jumps my heart right now to my mind is the fact that we seem to be having more cases of miscarriages than ever. And these are subjects that really bothers lots of families that many can't talk about publicly. And what can we just dive quickly into this?
Yeah, because it's part of a challenge in fertility too.
Yes.
The aim of conceiving is to have a live birth, not to have a miscarriage. Miscarriage is also rampant. The incidence of miscarriage is slightly increasing for reasons. Because in the past, diagnosis of miscarriage, people hide it, without even coming forth. And some people even had miscarriage without knowing because they feel they have delayed menses. But with improved technology, people come to check early, you're pregnant, then, in a while it's gone. Miscarriage is common, and because, there are things that could predispose to miscarriage. Atypical infection, even hormonal deficiencies can be associated with miscarriage. But the commonest cause of miscarriage among the causes that are known, particularly in the first trimester of pregnancy, that's the first 3 months, is genetic abnormality, chromosomal abnormality in the fetus, in the developing fetus. It does not mean that the parents are genetically abnormal, but it's the process of formation of the fetus. Something goes wrong. So nature, we try to sieve them out, to prevent the agony of having a child that is malformed.
Congenital issues.
Yes, there are some babies that could be born without head. A large majority of those children are...
Can we also look at the case of lifestyle of the mother in pregnancy that can make her less predisposed to having a child with congenital deformity?
Yeah, the lifestyle that could predispose to congenital malformation is what we rather want to talk about. Yeah, because there are some medications that are associated with birth defect.
Yeah.
There are some medications, so for anybody that is planning to conceive, should be careful on what you take. It has to be prescribed medication. There are even some prescribed medication that also have issues. And we caution that if you are planning to avoid this medication, if we're trying to prescribe those medications that we know that are associated with birth issues. There are some people who have undergone some cancer treatment, even though they still can conceive and deliver, we advise them, after this treatment, you must wait for 3 months, 6 months for the effect of the drug to wear out before you conceive. Wow. Because if you conceive within that limit that the medication is still there, it can predispose the child to having malformation. There are some drugs in the past that were even manufactured to help children, to help pregnant women to prevent vomiting in pregnancy.
Yeah.
But that drug was abandoned long ago in the 70s, early 80s, 70s.
Is Avomine safe?
Avomine is safe. Avomine is safe. That one, we call it thalidomide. Yeah, thalidomide. They were giving them, it was solving the morning sickness, but they discovered that children that were now born, some no hand, some no leg, kind of, before it was discovered and traced to that medication. Of course, it's out of the market long time ago.
So you were going to talk about a lifestyle that should be avoided.
Yes. Drug. Some people are addicted to some drug or dependent on some drugs. There are some drugs that are not really good.
Drugs or medications? Medications or hard drugs?
Yeah, you see, pharmaceutical say Panadol is a drug. But when we talk drug now, people will think we're talking of cocaine, hard substance, and the rest of them. Yeah, okay, let's say medications. There are some medications that are really not good for first trimester pregnancy. So we very careful, giving pregnant women some of these medications. Then there are some infection and infestation. This malaria that we commonize is one of the factors that can cause miscarriage. So, taking care of our environment is part of, taking control of this, trying to, decrease exposure to this. But luckily, because we're in the malaria belt, we all have immunity, and so the degree of malaria that will cause us problem is it has to be high. However, for pregnancy, it's different because there are some people who are not symptomatic, who have a symptomatic parasitemia, and they have the parasite in the system. It can cross the placenta and cause problem to the baby, not the mother.
Yes.
And then alcohol, cigarette smoking, excess of nicotine. Some people would like taking this tea with caffeine, too much of caffeine. These are substances that can cause blood flow issues within the placenta bed, and can affect pregnancy. So, so those things we try to, downplay on them. Pregnancy on its own is a risk factor to developing diabetes.
Yeah.
You understand? So if you know that pregnancy is a risk factor to developing diabetes, then when you're pregnant, it means that you should be careful not to take too much of carbohydrate, too much sugar, ice cream, this one, that one. Cut it down. Of course, there are cravings, and there's something they call cheating in diet. There are some days you can just forget yourself, feel good. But, that should be occasional. And not like, you see some people, because they feel they are craving every day of their life, they are drinking Coke. Because
some people like that. Pregnancy-induced diabetes is a subject I would have wanted us to major on, but because this is a whole broad issue that we are discussing here. In a case where, let's just touch one thing there, where a mother is having gestational diabetes, and what are the risks that can pose to both the mother and child?
Okay, gestational diabetes can actually pose a risk to either side. Let's talk about the child first. For the child, because the blood sugar of the mother is high, and sugar flows freely through the placenta to the baby. So the baby is bound to grow bigger than usual. They are bound to grow bigger. And because they are growing excessively, and too much of sugar leads to delay in maturation of some organs in the system, particularly the lungs. That's the breathing. So babies that are born, baby from diabetic mothers, tend to have slow maturation. This thing. So a baby that is born at 37 weeks to a diabetic mother could be equated to a baby that is born at 35 weeks to a non-diabetic in terms of lung maturation.
Lungs,
precisely.
But size is bigger.
Size is bigger. That reminds me of one of the cars I had in the past. This Camry 2005 model. They say big for nothing.
They call it Big Daddy.
So the child is big but not matured internally. And such problem gives rise. Okay, now, one of the major problems that children of diabetic mothers face is because they depend on free sugar coming from the mother. When they are born, and because of that, the sugar, the rate at which they metabolize sugar, their insulin, which is the hormone that is responsible for sugar metabolism, pushes sugar into the cell, is active. Because as sugar is coming, it's pushing it into the cell, and cell is growing. That's why they grow big.
Insulin is active.
Now, once the child is born, that free flow is cut off. And the insulin is still firing. Before you know, the blood sugar goes down for the baby.
So they can have hypoglycemia.
And if care is not taken, that can kill the baby.
Wow.
You understand? So that's one of the risks. So that's why that any baby that the mother is diabetic, once it's born, the first thing doctors are doing, or the nurses, is just to checking the blood sugar to make sure that
At intervals.
Yes, and also early feeding, to feed the baby to equate, so that until the body sense that this sugar is not coming freely again, or
does that make such a child more predisposed to insulin resistance?
Not really. Not really. They are not really resistant to insulin. The insulin is working and pushing the sugar into the cell. So the insulin is active. You understand? So what now happens is that if the sugar is not coming freely again as it used to come, then the insulin start cooling down. Yes. Coming down to meet with what is now happening. So but that first few hours, 24 hours is very critical for the child. If not, the child will have those problems.
Okay. Yeah. Go ahead.
Now, the other factors, then we'll talk about lung maturation. We'll call it respiratory distress syndrome.
Yes.
Yeah, because the child will come, because the lung is not matured, you won't be able to breathe well.
Can that make them predisposed to bronchiolitis?
Yeah, that bronchiolitis is a different, slightly different ball game. But this one now is from lung immaturation. Yes. The functioning of the lungs is low. So there's high pressure within the lungs. So the shallow breathing the child is taking cannot push air down into the lungs. So such child will now need artificial assistance, machine to help drive the air down. We call it CPAP, and sometimes they might even need intubation. But most of the time, CPAP will do. But now there are medications that also can be administered into the lungs. That is surfactant, we call it, because that's a chemical that is actually produced that opens the lung channel, because they don't develop surfactant early because of the high sugar level. If you give that medication, it helps them, calm down, and the breathing, comes to normal. And such children, once there's respiratory distress, it comes with other metabolic issues within the child. And sometimes, because of the low oxygen level that is being circulated, it can affect the brain of the child. Wow. So that's why it's not taken lightly. It's not taken lightly. The child needs to be monitored, make sure he's breathing well, make sure. Wow. And thank God now, the facility, technology exists that any baby that is born, you can just put a monitor to tell you real time what oxygen is going, the saturation of oxygen in the system, the pulse, the heart rate, and the rest of them.
And they're quite accurate.
Yeah, so that you can act fast.
Yeah.
You can act fast, because the problem is not the issue itself, but how fast you act to reverse it.
Yeah.
If you reverse it in time, it will just be like nothing happened. But if it has gone too long before you start acting, some damage could have been done before then. Now, these children also are more prone to infection.
More prone
to infection. So there are a whole lot of issues that comes with baby born with diabetic mother. However, if the diabetes is well controlled while the mother is pregnant, it reduces all these issues.
Can a pregnant woman take apple cider vinegar?
Yeah, apparently it's not like completely contraindicated, but it's you have to individualize. It's not a blanket statement.
Now, considering now the wider range of options for people who are dealing with fertility issues that they can explore, we've talked a bit about IVF. What I just want us to talk about before we move to another subject is that, are there things that can increase the chances of IVF working and things that can reduce the chance of IVF not working?
Oh, yes. Okay, there are. Because if we want to do IVF, we do not just jump and start doing IVF. We must do there are some certain tests we do.
Assessment
to actually find out the state, and if there are factors that are there that could affect the pregnancy, as it were, then we must have to correct those before you even go into the IVF itself. Some factors, one major factor that affects IVF is age of the woman.
Of the woman?
Yeah. Age is a major factor. The older, the less successful. Pregnancy generally.
From what age will you say is old?
Okay, I mean, fertility-wise, the prime age is below 35. Generally, good age is below 35 when we talk fertility. But when we say prime, below 30. But good age. But anything after 35, naturally, fertility starts to dwindle.
Okay.
But it becomes more manifest from 40, age 40. So if we're seeing patients, that come for IVF and your age is below 35, we are more at room, not at home.
Okay.
But then there are other factors too that comes in. You want to check the hormonal status. We'll talk about ovarian reserve. What is the state of the ovary in terms of the capacity to produce egg in number and in quality? That's ovarian reserve. Some people, usually before 35, ovarian reserve is very, very good. After 35, it starts to dwindle. And by 40, it nosedives. Be that as it may, there are some people that even at 25, their reserve has gone down.
Wow.
Yeah, we call it, premature ovarian failure, primary ovarian failure. Sometimes this has to do with the genetic makeup of the person. Then sometimes because maybe they are exposed to some toxic substance.
Chemicals?
Chemicals in early life, or...
Like creams?
Sometimes, this could come from creams, but exposure, environmental exposure, radiation exposure, or they've had cancer treatment, in the past, and these are things that can affect the ovary and brain. And some is just genetic, that the ovary retires earlier than it's supposed to. So, there are some genetic factors that could contribute to this a lot. So if the ovarian reserve is already down, you now have to modify, the protocol or whatever you want to use to try to up the chances. Then there are some factors, there are some people who have what we call endometriosis. Endometriosis is a big chapter that, that affects the ovary. It also affects the environment that will affect implantation. If it's there, these are factors that will affect the success of IVF. Some people have what we call adenomyosis. Adenomyosis is like fibroid, but not fibroid, it causes enlargement of the womb. What happens is the cells that we find in the lining of the womb, that is, we call it the endometrium, where is shed during menses every month. If you find such cells in the muzzle wall of the womb, every month that the woman is menstruating, that cell will menstruate where it is, but nowhere to come out from. So because of that, there's like minor blood accumulation within the wall of the womb. The body wants to take care of it. Inflammation happens. It enlarges. So every month this thing keep enlarging.
Can that cause sepsis? Can that give rise to sepsis?
No. That's different from sepsis because the blood is sterile. No infection. It's sterile. So it continues in that way, and it now change and distort the architecture of the womb lining. The wall becomes thick, and this affects implantation. So people who have that and are doing IVF, have to take that into consideration because these are factors that actually will reduce implantation rate and, eventually the success of IVF. Then we also talk of even lifestyle. Alcohol, hard substance abuse, all these things comes in to affect quality of the environment and also affect our success rate. See, so these are things we look out for, and try to correct. And sometimes vitamin deficiency, like I said, vitamin D, ferritin, that's iron level. These are micro things. Then there are some people who have what we call autoimmune disorder. autoimmune disorder in this guys means the body, has elaborates some substances, some chemicals, some defense mechanism that fights its own. When something, if embryo is coming in, or when sperm comes in and fertilizes the egg, as the egg wants to implant, it recognizes as a foreign body.
Yes.
And it starts fighting it. And the next thing is to kill it. And this also can happen to cause recurrent miscarriage.
Wow.
That's miscarriages. Some people have such. If we do tests and we'll find out, then there are some medication you now have to give to the person to calm that area.
Yes.
Do not recognize me as foreign. I'm a friend, kind of, so that this time will pass. And so if such exists, it also affects success rate of IVF.
Wow.
Even spontaneous pregnancy is in trouble in that scenario.
Yeah. What does an IVF process look like?
Yeah, IVF process is actually, I would say, it involves time. It involves emotion. Emotions. You understand? Yeah.
Why?
No, emotion because there are a lot of anticipation. Anybody coming to do IVF is because it's looking onto something.
Yeah.
I want to conceive and everything. Now that you have started a journey that you know that the end could be to the right or to the left, anxiety comes in, So, we try to advise and encourage people when they are coming for IVF, anything you yourself do not have control in, do not worry too much about it, because your worry will not even control it, but it will might bring some harm, to the whole scenario. So the process of IVF, number one, is start with the evaluation to make sure that, okay, everything is fine, and if it's not fine, we correct before we go in. And it involves taking injection on the woman's side, injections to make the woman produce egg. Not one egg, not two eggs. We want a good number of eggs, like upwards of 3, 4, 5, 6, 7, 8, 9, 10, The reason why we're talking of upwards is it's not all egg that you produce that are good, that are be...
So in the process, you have to extract.
We're going to extract, yes.
Yeah.
And the process, in the process we're going to extract. And now I want to say something so that it will correct some myth or some misconception that people have. They believe that, okay, when you do IVF, when they are doing IVF, you are exhausting the egg in the person's system, and everything. Naturally, the woman is tuned to produce 15, 20 eggs in a month. In a cycle. From the start of a woman's menstrual cycle, about 15 eggs is being recruited, follicles recruited to grow. But by the 6th day 7, naturally one become dominant and suppress the other ones.
Yes.
And that dominant one is the one that carries on to ovulate and go on like that. What IVF does, the medication given in IVF, is to make sure that that one is not one that will be dominant. Those ones that ordinarily were supposed to be suppressed,
yes,
it carries them along.
You can have as many dominant as possible.
Yes. So that, at the time of extraction, you can now get more than one egg that naturally you would have gotten. Be that as it may, at birth, just when a girl child is inside the womb, he has about 2 million potential eggs by month 5. At birth, those numbers would have reduced significantly. And by the time the woman gets to puberty, this would have been reduced to hundreds of thousands, about 500,000 thereabout. Now, this 500,000 that you have at puberty is what you'll be releasing every month till you get to menopause. And if you really want to take mathematics, let's assume that every month the woman is 20 is being recruited.
Yes.
Before. If you take the mathematics, you cannot exhaust it before menopause.
You cannot.
You can't. So menopause just comes and all the eggs that are remaining will just die off. Not that because the egg died, that menopause is coming. It's because you don't have eggs again. But it's just a process. At that menopause, the remaining one are no longer viable. So the IVF is taking advantage of those that would have just been wasted naturally, suppressed. Yeah. Don't be suppressed. We encourage them to grow. Then extraction. The process of extraction is with needle, fine needle, and under ultrasound scan guidance. Yes. So there's no surgery. There's no cutting or stitching just or whatever. Needle under ultrasound guidance. Go straight so that, because in the pelvis there are other structures. The intestine is there. Yes. There are blood vessels. Yes. So why we do it under ultrasound guidance? To make sure that you don't cause injury to any of those organs. You are going straight into the ovary and you extract. And once the egg is extracted, and one other thing is, what we are aspirating is the fluid that contains the egg. That's the follicular fluid. Yeah. We cannot see the egg.
No, we can't.
We can't see it under scan. So it's the fluid that contains it that we're seeing. And that's the fluid we're aspirating. Once we suck it out, then we'll now hand it over to the embryologist.
Yes.
That now look at it under the microscope, to try to identify the egg out of that fluid and pick the egg from the fluid and put it in a special fluid that is already prepared for it. Then sperm is now obtained to use to treat the egg, and the whole process.
The process of extracting the egg for the woman will be quite stressful.
Yes. Ordinarily it's supposed to be stressful, but, we do it under analgesia. Yeah. That painkiller, some conscious sedation, some sedation, so that, in a scale of 1 to 10, there should be, in terms of pain severity, yes. 1 being the mildest and 10 being the highest, we should have 0 to 1.
0 to 1. Yeah. Interesting. Yeah. Dr. Ono, let's look at another very important option that people have in case of infertility, which is the case of surrogacy. There was a time that this was not a thing in Nigeria accepted. Am I correct?
Taboo.
Taboo. Is it now accepted? Is it legal now in Nigeria?
Okay. Now, surrogacy, as it were, there is no legal framework in Nigeria. Around it, you understand? But it is not illegal.
It is not illegal.
It's not illegal, but the only thing is that the regulation, there's no strict regulation by the government on surrogacy around it. So what practitioners are doing is, leaning on the British legal framework, leaning on American legal framework in terms of building the surrogacy framework. However, the Association for Fertility and Reproductive Health of Nigeria, that's the Fertility Society, has been doing a lot of work, and I think there's a bill on the floor of the National Assembly now in terms of regulating surrogacy practice in this country. Yeah, granted, it is not illegal, as it were. However, anything that does not have a legal framework, a national framework, is subject to abuse. That's the problem that we have in subject to abuse. Some people, try to abuse it because there is no concrete framework. However, a lot of work is going on now, and I tell you that the acceptability of surrogacy is very, very high in Nigeria now compared to previously, and people are not even hiding. I've seen people who executive women, they work in highly placed institution, and they don't give a damn. And they tell the institution, look, I'm doing surrogacy. You get the point, and I'm expecting the baby, so I deserve the right to go on maternity leave. Yeah. Because you didn't see me pregnant does not mean, so it's come to that level that people are not, hiding. People are not, labeling, before, no, surrogacy, why, this and that, So that's the...
What does the process entail?
Yeah, the process of surrogacy is cumbersome. I put it that way. It's not just as it is on the surface, because it involves a lot of legal processes. You understand, and consenting, because it is not a commercial venture.
Yes,
it's a voluntary. It's a free will venture that's a contract between the gestational carrier, who is the surrogate now, and the intending parents, So it's not like a commercial thing. No, it's a voluntary process. The person who is going to carry, who is the gestational carrier, must know in details what the process is involved.
So
what is going to
get eggs from this person, you fertilize it?
You get egg from the intending parents. That's the people, involved now. That's the couple that have the fertility challenge. Egg from the woman, sperm from the man, fertilize, then transfer the fertilized egg, which is now the embryo, into the gestational carrier. That is, if I want to say it in a common language, womb borrowing.
Yes.
Lend me your womb for 9 months, and after that, you can go. Thank you, So the surrogate, which is the gestational carrier, carries the pregnancy, for 9 months, delivers the baby, and goes through the process of releasing the baby to the intending parents, because, of course, this baby has no genetic relationship to me.
With the person who carried.
Yeah, who carried, has no genetic. And for somebody to also do surrogacy, it's not like anybody can just walk in and say, I want to help. They have to check, screen the person is free of disease. The person too is not at risk of having any complication.
Yeah.
In the process of the pregnancy. So a whole lot of it involves a whole lot of.
So there are instances where certain couples, this woman can't carry this thing.
Yeah.
And now this option that is available now is surrogacy.
Yeah. There are several instances like that. Like I give an example. Like if somebody who for one reason or the other has the womb removed.
Oh, yeah.
Yeah. A womb can be removed in the course of maybe doing a fibroid surgery.
Yes.
And discover that after removing all this fibroid, this womb will be a problem to the woman. And the woman is trying to bleed to death on the table. You just have to remove the womb to save the life.
So even after that?
So far, the ovary is left behind.
Yes.
The woman is still fertile, just that it cannot carry.
Yes.
So you can get...
and that exists as an option.
No, it exists.
And what is beautiful is the fact that it is God who gave this wisdom and this, in the sense that we are so privileged that, we are having lots of this advancement. These are cases that people would have died and believe God didn't want them to have a child.
Yeah, correct.
And
correct.
now
a lot exists. Yeah.
What about the case whereby a woman is now approaching menopause? And she's saying that maybe we can have the egg stored and then fertilized and then a surrogate mother or something like that.
Okay. Yeah, a woman, the concept of fertility preservation comes in now that we have this knowledge. Long before you enter menopause, if for some certain reason you discovered, okay, I'm 38 now, I'm 39 now, and it's like, okay, I don't have a husband, I'm not married, but I know that I'm going to get married. Okay, I want to preserve my eggs because the performance of my eggs at 37 is far, far better than when I'm across 40, And this person could now preserve the egg maybe 5-6 years down the line,
Yeah.
Now there's husband and menopause have set in. All you need to do is you go back to your egg, because the egg will still remain at that age.
For how long
The
can it
womb-
be stored?
Yeah, before COVID, the law for preservation was like 5 to 7 years. But when COVID came, it was extended to 10 years.
Wow.
So, because when anything is coming afresh, we need to do research to make sure that, okay, this egg that have stayed this long, is it still going to bring a baby that will be okay and everything? So researchers have gone and discovered that 5 years, nothing has happened, no major difference or something. So extend until we can extend much more. So everything is per time.
If during the process of one of these things, egg extraction or something, someone has a complication, dies due to one complication, how many years after can you still fertilize the egg?
No, yeah, it actually depends. For now, we'll say 10 years. But you see, those scenario now becomes very, very dicey, kind of.
Mm-hmm.
There are some couple that already have maybe some challenge and everything. They say, okay, no, we agree we can do surrogacy.
Yes.
Even before any accident, any mishap, But when a mishap now happens,
Yes.
okay, like if in a couple situation where there's egg storage,
Yes.
when we are trying to store egg or store embryo,
Yes.
there's one thing we do. We have a consent, because you must consent to us preserving the.
Oh, yes.
Now, in that consent, there's a clause. If it is an embryo, that's the fertilized egg already.
Yes.
It's a joint ownership.
Yes.
The man and the woman.
Yes.
If it's fertilized already.
Yes.
If it is not fertilized, if it is egg,
Yes.
it's for the woman. If it is sperm, it's for the man.
For the man.
Now, for a fertilized egg, which is joint embryo, if we are freezing, if we are going to preserve,
You freeze embryos too?
that we call it freezing. we call it cryopreservation. That is cryopreservation is not the word we use.
I know about cryopreservation.
Because when we talk freezing, it causes a lot of misconception.
Yes,
I've once told somebody that we're going to freeze the sperm, bring it. So he got the sperm at night and went to put it in the freezer and brought it to me in the morning. That I started the freezing from home because I couldn't come. Of course, the whole sperm were dead by the time I was coming. So that's why I would like to use the word cryopreservation. It's a different
process.
The truth is, we don't even need electricity for this freezing.
Oh wow!
Electricity is not needed at all. The freezing process is, we call it liquid nitrogen. That's what we use to freeze, and it's not electricity. It's not dependent on electricity. It's just to be topping up from time to time. Though the gas is expensive, the liquid nitrogen is expensive.
But you're saying that from the medical intervention that we have now, if someone passes the process.
No, that's okay. I didn't complete this.
Yes.
So in the process of signing, when we are doing the preservation, we give a form because we know that nature. So, and in that consent, there's a clause that in the event that one person dies, what happens? So you have to also give that consent that the partner can take.
Go ahead.
It said that partner can go ahead, or we agree that no. If one person is not there, then destroy discard the embryo or give to couples that other couple that there are a lot of options, so that it is clear from there what we should do with the
if a person consents.
Yeah, no, that's
Then even 10 years after.
Most of the time, there's usually consent.
Awesome.
Most of the time, from my experience, it's a consent. Okay, if I'm not around, just let my husband decide what to do, or let my wife decide what to do with it. And that makes a lot of things easier for. So after maybe 4 years, 5 years, you still want to make use of that embryo. Yes,
you can. Dr. Onu, it's been so amazing speaking with you. Just last question, then I let you go. I know how busy your schedule is. Apart from IVF, surrogacy, and drugs and all that, are there other options that people can also take advantage of now?
Yeah,
for them to be fertile.
Yeah, fertility is, wide range. There's, we talked about third party If we want to go much higher, there's organ that's grafting.
Okay.
Ovarian transplantation, womb transplant.
These are advanced options.
Yeah, these are advanced options, but womb transplant has really worked. There are cases now, people delivering with transplanted womb and the rest of them. Yes, but the cost is out of this world. It's only, people that are sponsored and everything, or institution. Yeah. Anyway, we'll have some people who can still fund this by themselves. However, the large majority of people that need it apparently cannot fund by themselves and the rest of them. Then we'll have third-party reproduction. That is where you bring, we talked about surrogacy as a third party. Then, there's an area that I just want to touch. There are some people who are ordinarily exospermic. No sperm.
Yeah.
But their problem is a blockage. Not that the sperm is not produced in the testes. Yeah. What we do in such situation is just to go straight to the testes to aspirate the sperm. The
way you are saying it is like simple.
So surgical sperm retrieve the sperm, and you can use it in IVF, So it's a lot of people have benefited from that. But ordinarily it would have been a no-no situation because sperm is not coming out at all. There's no sperm at all. Then there are some people who, because of one reason or the other, maybe they've done prostate surgery or this and that, so they have, once they ejaculate, the sperm goes into the bladder.
Really?
Yeah, rather than coming out.
Yes.
So we call it retrograde ejaculation. So what we do in such situation, and once the sperm enters the bladder, it just takes a few minutes before it dies off because urine is acidic.
Uric acid.
Yeah, it's very acidic. So what we do is give such a person medication to make the urine alkaline over a period of time, 2 days, 3 days.
From there.
Yeah, so now allow the person to ejaculate and now urinate after ejaculating. So from that urine, we can now sediment and pick the sperm cell that we can use for process of IVF.
And these are things that many would probably believe that maybe it was not in God's plan for them.
Yeah, because there's no sperm cell.
But now we are seeing God's plan through the availability of the wisdom is given to us. I want to really thank you, Dr. Ono, for coming. You've been instrumental in many homes, and we beg that we're going to bring you at some point again. I know how busy your schedule is. I want to thank you so much, and to everyone connected. Thank you, Doctor.
Thank you very much. It's a pleasure. I actually take delight in sharing knowledge to people, because knowledge is power, and a lot of people have a lot of misconception that we will not allow them to have the full benefit of the blessings that God has for them.
Yes. Thank you so much for coming.
Thank you, sir.
There is a kind of church that the devil is happy with. In fact, some people all their life don't know what church looks like. They've just